Bonjour tout le monde. Hello
Good
everyone.
morning, everyone.
I want to begin by addressing the COVID-19 situation in Manitoba. The record numbers the province has seen over the last few days is really concerning. In light of this surge, we're partnering with Manitoba First Nations to provide over $61 million in immediate funding to support their response. This funding will support public health measures, food security, and other surge capacity needs. In addition, Indigenous Services Canada is mobilizing contact tracers and equipment to further help affected communities. Of course, Manitoba isn't alone. Across the country and around the world, we're seeing rising numbers of COVID-19 cases. This was the main focus of my calls with President-elect Biden and Prime Minister Johnson yesterday. With rising cases of COVID-19 here at home, there's added pressure on all orders of government to keep people safe and to protect jobs. But I would hope that no leader in our country is easing public health vigilance because they feel pressure not to shut down businesses or slow down our economy. I understand that worry, but let me tell you, that's how we end up with businesses going out of business and the economy damaged even more. Beating COVID is the only way to protect our economy. Yes, we have great news of possible vaccines on the horizon, but a vaccine later won't help you or your family if you get sick now. The federal government is here to help your communities. We are providing unprecedented direct support to those businesses impacted by any shutdown orders. We are there for workers who lose hours, who lose their job. It's tough, but I know we can get through this. We're seeing record spikes this morning across the country. So I urge the premiers and the mayors to please do the right thing. Act now to protect public health. If you think something is missing in the support we're offering your citizens, tell us. We will work with you as we have since day one. The federal government promised to have Canadians' backs, and we will, whatever it takes, for as long as it takes. We all know the virus is surging. So once again, I'm asking all Canadians to please follow your local public health guidelines. Wash your hands, wear a mask, keep a safe 2 meters distance from each other, and download the COVID Alert app. Together, we will get through this. Au cours des derniers jours, le Canada a
Over the last
enregistré
few
un
days,
nombre
Canada
record
has seen
de cas
a record
et la
number
situation
of
nous
cases,
préoccupe.
and the situation is a
Le
great
virus
concern
se
to me. The
propage
virus
rapidement
is
et c'est
spreading
pourquoi
quickly,
on doit
and that is
continuer
why
nos
we
efforts.
must continue our
Alors, s'il vous
efforts.
plaît,
So
suivez les
please,
conseils de vos
follow
autorités de
the
santé
directives
publique.
of your public health
Lavez-vous
authorities.
les mains,
Wash your hands,
portez le masque,
wear a mask,
gardez une distance
and keep
sécuritaire
a
de
safe
2 mètres avec
distance
les
of
autres
2 meters
et
away from
téléchargez
others,
l'application
and
gratuite
download the
Alerte
free
COVID.
COVID Alert
C'est en travaillant
app.
ensemble
By
qu'on
working
va passer
together,
au travers
we
de
will
cette
get
crise.
through this crisis.
Job one right now is keeping people safe. So whether it's by buying more PPE or helping to ramp up testing, that's what our government is focused on. Over the past few days, we've provided over 1.2 million pairs of nitrile gloves to workers on the front lines, with millions more to come. We've also provided over 3.3 million rapid tests to the provinces and territories, with more on the way. And to ensure that we have as many resources as possible, Health Canada approved another rapid test, the BD Veritor. This is a handheld device that can process a test in just over 15 minutes. Canada has a contract for 7.6 million of these tests overall, with millions arriving before the end of this year. We expect delivery to start in the next few weeks. À ce jour, nous avons fourni plus de 3,3 millions de tests de dépistage rapides aux provinces et aux territoires
tests to
et
the
plusieurs
provinces and
autres
territories, and many more will
Et pour
follow.
assurer notre
And
accès
in
au
order
plus
to
grand nombre de ressources
ensure our
possibles,
access to
Santé
the
Canada
broadest
a
range of
approuvé un
assets,
autre outil
Health
de
Canada
dépistage rapide,
approved
le
another
BD
rapid test, the BD Veritor.
Il s'agit d'un appareil
This is a
portatif qui
handheld
peut effectuer un
device
test en un
that
peu
can
plus de 15
carry out a
minutes.
test and give results within
Canada a
15
conclu
minutes.
une entente pour
Canada
obtenir
has signed an agreement to buy
7,6 millions de ces
7.6
tests au
million
total,
of these
avec la
in total,
livraison des premiers
with the
millions
delivery of the
prévus
first
pour les semaines à venir.
devices arriving in the next few weeks.
Finding a safe, effective vaccine is vital to stop the spread of COVID-19. That's why we've secured millions of doses of potential vaccines from the world's leading vaccine manufacturers and therapeutics. Right now, scientists and companies are working around the clock, and just yesterday we heard promising news from Pfizer and BioNTech's vaccine candidate. Canada signed a deal to secure millions of these doses back in August, adding to our diverse portfolio of potential vaccines and therapeutics. We will continue to support researchers and scientists in the weeks and months to come. Hier encore, on a reçu des nouvelles encourageantes
Yesterday, we
concernant le candidat
heard
vaccin de
encouraging
Pfizer et
news
BioNTech.
about BioNTech and
Le
Pfizer's
Canada a signé un
vaccine.
accord pour obtenir
Canada
des
has signed
millions
an
de
agreement
doses de
to
ce
buy
vaccin,
millions of doses
qui fait
of this
partie de nos
vaccine,
options
which
diversifiées
is part
de
of our
vaccins potentiels.
diversified options
Nous
on
allons
the
continuer
potential
de
vaccines.
collaborer
We'll
avec les
continue to
scientifiques
work
et
with
lorsqu'un vaccin
scientists and
sera
researchers,
approuvé,
and when
nous
a
allons
vaccine is approved, we will be ready.
Since the start of this pandemic, we've seen Canadian companies step up to make personal protective equipment. And as a part of our Made in Canada plan, we've been supporting businesses like General Motors in Oshawa to do just that. So far, they've made nearly 5 million masks for people right here at home. These masks are made by Canadians for Canadians. And the production of these essential pieces of PPE are creating good jobs. On that note, the newly ratified agreement between GM and Unifor is great news for workers and for our auto industry in Canada. I spoke with Mary Barra, the CEO of GM, yesterday, and we're both excited about what our future collaboration could bring. This agreement brings up to 1,700 new, good-paying jobs in Oshawa while securing jobs in St. Catharines and Woodstock. This is a vote of confidence by industry leaders in Canada's economy. Our government will continue to work with our partners to ensure that Canadians get good jobs they can rely on. I want to end this morning by taking a moment to recognize that tomorrow we will mark Remembrance Day. Canadians would normally gather at cenotaphs across the country to pay tribute to those who fought for our freedom. People would gather at local Royal Canadian Legions to thank the heroes who kept this country strong and free. But this year will be different. COVID-19 means many ceremonies are online. Many veterans are staying at home. And too many of the legions that provide support for them are facing tough times themselves. Our veterans served Canada with honor and valor. They stepped up for us, and now we must step up for them. So today, I can announce that the Government of Canada is providing $20 million to create the new Veterans Organizations Emergency Support Fund. This fund is designed to help veterans organizations keep providing services. Over $17 million of the funding will go to the Royal Canadian Legion, ANAVETS, True Patriot Love, and Vets Canada. The remaining amount is available through application to other veterans organizations that have been affected by COVID-19. Minister MacAulay will have more to share on this in a few minutes. But to the women and men who've served our country, I want to say this. You represent the best of who we are, and we will forever be in your debt. And to all those who bravely serve today, thank you for everything you do. Aujourd'hui, j'annonce que le gouvernement du
Today,
Canada
I'm
va
announcing
investir
that
20
the Canadian
millions de
government
dollars
will
dans la
invest $20
création
million
du fonds
in the
d'urgence à l'appui
creation of the
des
Veterans
organismes de
Organizations
vétérans.
Emergency Support
Ce fonds est
Fund.
conçu pour
This
aider ces
fund has been
organismes
designed to
à
help the
continuer de fournir des
organizations
services
to
pour
keep
soutenir
providing
ceux qui
services
ont
to
été
support
touchés
those
par la
who
crise.
have been affected by the
Cette
crisis.
semaine,
This
même
week,
si on ne peut pas se rassembler
even
comme
though
on a
we can't
l'habitude de le faire,
gather as we
on peut
usually
toujours
do,
montrer
we can
notre
always
soutien à
show
nos anciens
our
combattants
support
en
for our
portant un
veterans
coquelicot et en
by
regardant les
wearing a
cérémonies du
poppy
jour du
and
souvenir
watching
en
the
ligne.
ceremonies online on
J'encourage les
Remembrance
Canadiens
Day.
à
I
rechercher le
encourage
mot-clic
Canadians
Le
to
Canada
look
se souvient
for Canada
sur les médias
Remembers
sociaux
on
pour
social
lire des
media
récits de services et
in
de
order to
sacrifices
read
à propos
about
de
the
nos
service and
braves femmes et
sacrifices
hommes
of
en
our many
uniforme.
brave men and women in
En
uniform.
vue du jour du souvenir,
Thinking of
rendons
Remembrance
hommage à
Day,
nos anciens
let's
combattants
pay
qui nous ont
homage
tant
to our
donné
veterans who
et
have
à nos
given us so
militaires
much
qui continuent d'être
and
là
to
pour nous.
those who continue to serve
Merci.
today.
Je
Thank you
passe
so
maintenant
much,
la
and I
parole
will now give
au
the
ministre
floor
MacAulay.
to Minister
Lawrence.
MacAulay.
Thank you very much, Prime Minister, and good morning. I'm so pleased that the Government of Canada is providing $20 million to veterans organizations that have been hit so hard by the pandemic. The last few months have been rough on folks, and our veterans are certainly no different. It's been a tough time for them, but it's also been the tough time on the organizations that support them. The newly created Temporary Veterans Organization Emergency Support Fund will help veterans organizations access money to address the shortfalls caused by the pandemic. Legion branches will apply for funding through the Legion's Dominion Command. Anavet's branch will apply through their Dominion Command. Other organizations can apply for funding through our website at veterans.gc.ca. These organizations provide essential service and make a real difference in the lives of our veterans and their families. They also play a critical role in their communities, including by supporting homeless and disabled veterans. As I said, veterans have been hit hard by this pandemic. Some are at risk because of their age and declining mental and physical health. Others are more vulnerable because of homelessness or because they are now in long-term care homes. But that's what makes the works of these organizations so important. The Legion, Anavets, Through Patriot Love, Vets Canada, and all the others who will be receiving funding. These organizations change lives and they save lives. And above all, they're there when our veterans need them. The Veterans Organization Emergency Support Fund is there to make sure that we can continue to be there for them now and in the future. We owe a lot to our veterans. Their legacy is a legacy of service and sacrifice that we could all do well to remember at times like this. They were there for us, and we will continue to be there for them. Thank you.
Thank you. Thank you, Lawrence. Good morning, everyone. With tomorrow being Remembrance Day, our thoughts turn to our veterans and their families, to those who served and continue to serve our country. Thank you for seeking a more peaceful world. We are so grateful. Today, I would like to provide you with a brief update on our procurements. We continue to procure PPE, personal protective equipment. We have procured more than 2 billion items of PPE as a result of the long-term contracts that we have put in place in anticipation and preparation for a potential second wave. En plus d'obtenir de l'équipement de
As well
protection
as
individuelle,
procuring equipment for personal protection, other supplies, and potentially a safe and effective vaccine, we will continue to acquire tests, rapid tests, in order to help the provinces and the territories to reduce the spread of this virus. So today, Minister Haidu and I are announcing that our government has signed an agreement with Becton Dickinson of Ontario to acquire approximately 7.6 million of these rapid antigen detection tests and 2,000 analyzers.
Which have been approved by Health Canada, can provide results in as little as 15 minutes with a nasal swab. We expect to begin taking delivery of the Becton Dickinson tests later this month, at which point the Public Health Agency of Canada will deploy them to provincial and territorial counterparts to support their COVID-19 testing regimes. I would also like to provide an update on the delivery of Abbott's ID Now and PanBio tests previously announced. To date, in excess of 3 million of these rapid tests have already been delivered to the provinces and territories for use in their jurisdictions. Deliveries are continuing on a weekly basis. These tests will play an important role in helping Canada to cope with rising case numbers and will supplement the existing standardized testing regime.
We are also preparing for the moment when a vaccination will be available. Public Services and Procurement Canada has launched an invitation to qualify with a view to finding one or more tests, or for suppliers rather, able to offer a comprehensive logistic solution that will allow for the physical distribution of vaccines to the provincial and territorial authorities or at the points of administration.
70 companies participated in PSPC's recent bidders conference, ranging from cargo airlines to couriers and healthcare supply companies to cold chain experts. The logistics associated with vaccine procurement and distribution are complex, especially in light of the need to transport and store vaccines at specific temperatures, which can vary depending on the vaccine itself. We are moving quickly to put these logistical arrangements to ensure that when a vaccine is ready, Canada will also be ready.
In conclusion, don't forget to watch out for the safety of each and every person, and rest assured that the Canadian government will be there to support you and help you to stay healthy and safe throughout this long pandemic.
Good afternoon. Bonjour à toutes et à tous.
Good afternoon,
There have been
everyone.
268,735 cases of COVID-19 in Canada, including 10,564 deaths. Nationally, there are close to 40,000 active cases across the country. Over the past week, labs across Canada have tested an average of close to 55,000 people daily, with 5.8% testing positive. Yesterday, 4,086 cases were reported nationally. In addition, there were close to 9,000 new cases reported for Saturday and Sunday. This brings the average daily case count to over 3,800 cases for the past week. The number of people experiencing severe illness is also continuing to increase. Over the past 7 days, there were on average over 1,300 individuals with COVID-19 being treated in Canadian hospitals, including almost 250 in critical care, and an average of 51 deaths were reported each day. With the continued increase in daily cases, percentage of people testing positive, and still rising numbers of people being treated in hospitals across the country, it is clear we have yet to bend the curve on accelerated growth in Canada. Now, as our activities move indoors during the colder weather, providing even better opportunities for the spread of respiratory viruses, it's time to get really serious. Going into this respiratory season, COVID-19 is already well ahead of us. Outbreaks continue to contribute to COVID-19 spread in Canada and are being reported in a range of settings, including long-term care and assisted living facilities, schools, congregate living settings, industrial work settings, and social gatherings. So you get the better of an opportunistic virus that spread through everyday interactions. When infected people talk, sing, shout, cough, or sneeze, we need to avoid the 3C settings and situations: closed spaces, crowded places, and close contact situations that give it an advantage. We also know that prevention practices we need to do to get ahead of the virus, layering on our protections is the key, and nobody knows layering like Canadians in winter. We start with the most important decision. Stay home and self-isolate if you have any symptoms. Add on an essential base layer of 2-meter physical distancing and frequent hand, cough, and surface hygiene. Finally, we top it off with a protective outer layer of a non-medical mask or face covering when in public or any indoor space where there are people from outside your immediate household. Tomorrow marks Remembrance Day, when we honor those who have served Canada in the past and present, in times of war, military conflict, and peace. While we may not be able to come physically together this year to commemorate their courage and sacrifice in person, I know we are one in holding them in our thoughts. Together, we remember, and together, we can do hard things. Thank you.
Bonjour à toutes et à tous.
Welcome,
Il y a eu
one and all.
268
There
735 cas de
have been
COVID-19 au Canada, dont
268,735 cases of
10
COVID-19 in
décès.
Canada,
Il y a
including
près de 40 000 cas actifs
10,564
au
deaths.
pays.
Nationally,
Au cours
there
de
are
la
close to
dernière
40,000
semaine,
active
les
cases across the
laboratoires de
country.
l'ensemble du
Over the
pays
past week,
ont
labs across
analysé les
Canada have
tests de
tested
dépistage de
an
près de
average of close to
55 000
55,000
personnes
people
par jour
daily,
en moyenne,
with
dont
5.8%
5,8%
testing
ont reçu
positive.
un résultat positif. Hier, 4
Yesterday,
086 cas ont été
4,086
signalés au pays.
cases were
De
reported
plus,
nationally.
près de 9
In
000
addition,
nouveaux cas
there
ont
were close to
été
9,000
enregistrés
new
samedi
cases
et
reported
dimanche,
for Saturday
ce qui
and
porte le
Sunday.
nombre moyen de
This
cas
brings the
signalés
average daily case
quotidiennement
count
à plus de
close
3
to
800.
over
Le nombre de
3,800
personnes
cases for the
présentant
past week.
des
The
symptômes
number
graves
of people
continue
experiencing
également
severe illness is
d'augmenter.
also continuing
Au
to
cours des
increase.
7 derniers jours,
Over the past
on a
7
dénombré
days,
en
there
moyenne
were on
plus de
average over 1,300 individuals
300 personnes atteintes de
COVID-19
COVID-19 dans les
being
hôpitaux
treated in
canadiens,
Canadian
dont presque
hospitals, including
250
almost
aux soins
250
intensifs
in
et
critical
51
care,
décès
and an
par
average
jour.
of 51 deaths were
Comme on
reported each
continue de
day.
voir une
With
augmentation
the
du nombre de
continued
cas
increase in
quotidiens,
daily
du
cases,
pourcentage de personnes
percentage
qui
of people
reçoivent
testing
un
positive,
résultat
and
positif
still rising
et du
numbers of
nombre de
people
personnes
being
qui sont
treated
traitées
in
dans
hospitals
les
across the
hôpitaux au
country,
pays,
it is
il est
clear
clair que
we
nous n'avons
have
pas
yet
encore
to bend the
ralenti la
curve on
croissance de la
accelerated
courbe au
growth
Canada.
in
Maintenant,
Canada.
comme nous
Now,
exerçons
as our
plutôt nos
activities are
activités
moving
à
indoors during the
l'intérieur
colder
quand il fait froid,
weather,
ce qui
providing even
favorise
better
encore
opportunities
plus la
for the spread of
propagation du virus
respiratory viruses,
respiratoire,
it
il
is
est temps de
time to
prendre
get
les choses
serious.
au sérieux. Alors que cette période
Going
des
into
infections
this
respiratoires commence,
COVID
nous luttons
winter
déjà contre la
season,
COVID-19.
it is
Les
already ahead
éclosions
of us.
continuent de contribuer à la propagation de la
Outbreaks
COVID-19
continue to
au Canada
contribute to
et sont
COVID-19
signalés
spread in
dans
Canada
divers
and are being
milieux,
reported in a
notamment
range
dans
of
les
settings,
établissements de soins
including
de longue
long-term
durée
care
et les
and
résidences-services,
assisted living
les
facilities,
écoles, les
schools,
établissements d'habitation
congregate
collective,
living
les
settings,
milieux de travail
industrial work
industriels et les
settings,
rassemblements
and
sociaux.
social gatherings.
Pour avoir raison
To
d'un
get
virus
the
opportuniste,
better of
c'est
an
que propage
opportunistic
dans le
virus
cadre
that
des interactions
spreads through everyday
quotidiennes lorsque
interactions
les personnes
when infected
infectées
people
parlent,
talk,
chantent,
sing,
crient,
shout,
toussent ou
cough,
éternuent.
or sneeze.
Nous devons éviter
We
les
need to
becs,
avoid the
les lieux bondés,
3
les
Cs:
contacts étroits, les
close
espaces clos.
contact and
De
closed
même que les
spaces.
situations qui procurent au
We
virus un
also
milieu
know what
propice.
prevention practices
Nous
we need
connaissons
to do
aussi
to
les
get ahead
mesures
of
de
the
prévention
virus.
à mettre en pratique pour ralentir la propagation
And
du virus.
layering
L'application de
our
couches de
protections
protection est
is
la
the
clé.
key,
Et personne
and
d'autre ne sait
nobody
mieux que les
knows
Canadiens
layering
ce qu'on
like
entend
Canadians
par
in
l'application
winter.
de couches en hiver. Nous commençons par la
We
décision
start with
la plus
the most
importante.
important
Rester à la
decision.
maison et
Stay
nous
home
auto-isoler
and
si nous avons des
self-isolate
symptômes.
if you have any
Nous
symptoms.
ajoutons à cela
Add
une couche de
on
base
an essential
essentielle.
base layer
Distanciation
of
physique de 2
2-meter
mètres,
physical
hygiène
distancing,
fréquente des mains,
and frequent
étiquette
hand,
respiratoire
cough,
et
and
hygiène des
surface
surfaces.
hygiene.
Pour terminer, nous ajoutons
Finally,
une
we
couche de
top it off
protection
with a
extérieure,
protective outer
masque
layer
non
of
médical
a
ou
non-medical
couvre-visage
or
lorsque
face
nous sommes en
covering
public
when
ou
in
dans un
public
espace
or any
intérieur
indoor
avec des
space where
personnes
there are people
n'appartenant
from
pas à notre
outside your
ménage
immediate
immédiat.
household.
Nous soulignons demain le
Tomorrow
jour
marks
de souvenir
Remembrance Day,
afin d'honorer
when
les
we honor
personnes
those
qui
who
ont
have
servi
served
dans le
Canada
passé et
in
qui
the
servent
past and
actuellement
present.
le Canada. En temps de
In
guerre,
times of
de
war,
conflits militaires et
military
de paix.
conflict, and
Nous ne
peace.
pourrons pas nous réunir
While we may
physiquement
not
cette
be
année
able to
pour
physically
célébrer
come
leur
together this
courage
year
et
to
leur
commemorate
sacrifice
their
personnel,
courage and
mais je sais
sacrifice in
que nous sommes
person,
unis
I know
et
we
que
are
nous
one
pensons
in holding them
les
in our
accompagnent.
thoughts.
Ensemble,
Together,
nous nous
we
souvenons
remember,
et ensemble,
and
nous
together,
pouvons
we can
accomplir
do
des choses
hard
difficiles.
things.
Merci.
Thank you.
Thank you, Doctor. We'll now turn to the phone for questions. After a number of questions on the phone, we'll return to the room. Operator?
Thank you. Merci. Première question, Hélène Buzetti, Le Devoir, à vous.
Question?
Bonjour, Monsieur
Yes,
Trudeau.
good afternoon, Mr. Trudeau. Today, CBC Radio-Canada is learning that Ottawa is emptying the immigrant detention centers because of COVID. So should people be afraid for their security and safety? And if the answer is no, if these people are not dangerous, why are they being held in the first place? Answer. The safety and security of everyone is always a priority for us. The decision was taken to use these alternative centers rather than the detention centers, which is always the last choice for us.
The health and safety of everyone is always a priority for us. Detention centers, immigration detention centers are always used as a last resort, and the decision has been made by CBSA to use other facilities rather than detention centers.
Supplementary question. I understood that some people have been released into the community. So if we can do that because of the pandemic, why can't we do it all the time? Answer. Well, I think that one of the things that we're always thinking about during the pandemic, when we're doing things differently, is to think about the best way of doing things. Some things will convince us to think differently in the future. Because if we're doing something in this situation, there are
less ordinary ways during this pandemic that it gives us pause and allows us to reflect on maybe we can do things differently or better into the future. I think there's a number of things that we'll be looking at within our systems that we may make changes to. Right now, however, we're very much focused on fighting this pandemic.
Merci. Prochaine question. Operator?
Thank you. Merci. Prochaine question, Raymond Filion, TVA, à vous.
Question. Good morning, Prime Minister. You said a few minutes ago that you ask the premiers and mayors to do the best thing in the interest of public safety. Why do you feel the need to launch that appeal today? Do you feel that there are premiers and mayors who are not taking the right steps? Do you think that they're loosening restrictions too easily? Answer. Well, we've seen that there's been a significant spike in cases across the country, and we can also see, we know, in fact, through our experience, that acting quickly to protect public health is the best thing to do. And also is to protect the citizens of this country as well as the economy for the months and years to come. The federal government has taken the necessary steps to be present to support workers and families as well as businesses who have to change their behaviors or even close down because of the pandemic. And so this is to give the ability to local and regional decision makers to act quickly in order to protect people's health, in the full knowledge that the federal government will be there to protect the economy. We know that we have to act quickly, and this is what we encourage all provinces and regional authorities to do.
I think we're seeing a significant rise in cases across the country. And we know that people are trying to balance a time where people are getting tired and frustrated by COVID-19. But we also know that the best thing to do to protect not just the health of Canadians, but the health of our economy into the medium and long term is to do what is necessary to keep people safe from COVID right now. But in order to make those decisions easier for local and provincial public health authorities, the federal government has continued to step up. We're there with direct supports for families. We're there with direct supports for workers. We're there with direct supports for businesses, including extra top-ups for businesses that are forced to close because of local public health directives. We at the federal government are making it easier for provinces to do the right thing and shut down and put in restrictions so that we can control the spread of COVID-19. We see vaccines on the horizons, but we are not there yet. We need to make it through this winter. And in order to do that, we have to put the health of Canadians first, which is also the way to put the economy first, because we know if businesses continue to suffer under surges of COVID-19, the damage will be longer lasting than targeted shutdowns and federal financial supports.
Suivi, Ray?
Supplementary question. Do you see any shortfalls locally in local areas? And you talked about the Pfizer vaccine yesterday. Minister Anand said a word about that. Very few companies have the facilities to store a vaccine at minus 70 degrees Celsius. So how are they going to buy those kinds of freezers? Answer. Well, first of all, to the first question, we are there to respond to local needs. We're asking communities, municipalities or provinces if there's more that we can do as a government. Is there more that we can do to come to their assistance in taking the right decisions to protect people? We are working together, and we have been doing so since the beginning of the pandemic. We'll continue to be present, and we are simply asking if there's more we can do to help local authorities to make the right decisions quickly. And so far as the Pfizer vaccine is concerned, indeed, the logistical requirements are complex. We have to store the vaccine at minus 70 degrees Celsius, and that is a big challenge in order of transporting and distributing the vaccine at those temperatures, and that is why we are developing a tangible plan. That's one vaccine amongst many. They don't all have that requirement, and therefore it's logical to look at the ways that we can most effectively distribute this vaccination, and we will be having conversations with the regions and provinces on the best way to ensure a rapid distribution that is effective to the people who are priority receivers of the vaccine.
We'll take one more call on the phone, please. Operator?
Thank you. Merci. Next question, Ryan Timothy, National Post, line open.
Yeah, sir, you're calling on provinces and mayors to do the right thing with regards to the COVID restrictions. I'm wondering if you can define what you view as the right thing. And also, you've been hesitant. You said you won't invoke the Emergencies Act to take that decision away from them. Is there a point at which you would change that stance and have the federal government step in and impose these restrictions?
From the very beginning, we have worked extremely well with the provinces and territories to ensure that Canada has had good success despite all the tragedy and loss in managing COVID-19. We are in the middle of a very concerning spike right now that is lining up with the arrival of winter as people are going to go inside, and we know that poses real challenges. Our responsibility as a federal government is to be there to support Canadians as we move forward and to directly support provinces and territories as they make the decisions that are right for their territories. But we know from watching the course of the virus around the world and in other jurisdictions that acting quickly to shut down early, to bring in restrictions when the surges start, is better than delaying and hoping that it'll go away on its own. That's why we've made those decisions easier for provinces and territories by being there with financial supports for workers, for families, for businesses that are facing tough times because of COVID. Because we all want things to get back to normal. And if businesses go under because of the COVID-19 pandemic surges, we end up worse off in the recovery. We want people to be able to hold on through this challenge. That's why we're there directly to support businesses and people right across the country. And that's why we certainly encourage the provinces to act quickly to control the spread of this virus with the measures that increasingly scientists and experts around the world are agreed are effective. Targeted shutdowns, limits where necessary. We're seeing Europe right now that went through a bit of a loosening over the summer, perhaps more than they should have, now having to bring in far more restrictions than even now we're looking at in the hardest hit parts of this country. So there is a way of acting quickly to prevent challenges further down the line. And as a federal government, we're there to support the provinces who make those decisions by directly supporting their citizens. Okay. Nous savons que d'agir rapidement
We know that acting quickly
avec fermeté
and firmly
pour fermer certains endroits
to
pour
shut down
mettre
certain
des limites à
areas
d'autres.
and
C'est la
putting
meilleure
on
façon
limits
de
on
contrôler
others,
les
imposing
éclosions
limits on
de la
others is the
COVID-19.
best
On l'a
way
vu,
of
par
containing the
exemple,
spread
en
of
Europe,
COVID-19.
où,
We've seen
ils
in
ont
Europe, for
tardé un petit
example,
peu à refermer dans la
where
deuxième vague et sont en
they
train de
didn't
vivre
shut
des
down as
moments et
quickly
des
in the second
restrictions assez
wave,
difficiles.
and they're now dealing
Si
with
nous, on
very
peut
tough restrictions.
éviter, en
If we
apprenant
can avoid
la
that
leçon des autres
by learning
et
lessons through others
en agissant rapidement,
and by acting quickly,
ce serait mieux, pas
it
juste
would
pour
be
la santé
better,
des gens,
not
mais
just for
pour
people's
l'économie
health,
aussi.
but for the economy
Mais
as
c'est
well.
pour ça que le
And
gouvernement
that's why
fédéral
the federal
a fait la
government
décision dès
has
le
taken
début
the decision
d'être
from the
là
outset
pour
to be
appuyer
there
directement
to
les citoyens,
support
les
people
entreprises,
directly,
les
to support
communautés qui
businesses
en ont besoin,
and
les
communities who
organismes
need this.
sans but lucratif qui aident les
Nonprofits who
autres.
are
On a
helping
été là
others,
directement pour
we
les aider,
have
pour
had their
permettre
backs in order
justement
to help
aux autorités locales
indeed
de santé
local
publique de
authorities
prendre la bonne
to
décision
make the right
et
public health
d'amener et
decisions
d'imposer des
and
restrictions
also to
pour
bring in
justement
restrictions
permettre de contrôler
to allow
ces
us
éclosions
to control
sans
these
faire
outbreaks
souffrir l'économie au
without
long terme.
making this economy
Pour
suffer in the long
pouvoir
term.
passer à travers de
In
cette
order
pandémie,
to
pour
get through
pouvoir
this
avoir une économie qui revient en
pandemic
force,
and having
il faut
an economy
qu'on
that comes
contrôle
back
l'éclosion
strong,
de la
we
COVID-19.
have to control
Et c'est
the
pour ça que
outbreaks
le
of
gouvernement
COVID-19
fédéral
now. And
est
that
là
is
pour
why the
appuyer
federal
les gens
government is
qui
there
doivent
to
fermer
support
à cause
people
d'ordres
who
publics.
have to shut down because of public
Follow-up, Ryan?
directives and orders.
Yeah, so just on the other half of my question about the Emergencies Act, you said that premiers should be acting at the start of the surge, which so far they haven't done. In Ontario, we're even loosening restrictions as the surge continues. Is there a point at which you would consider invoking that act and having the federal government make those choices?
I've had over 20 conversations with the First Ministers directly, 20 First Ministers meetings since the beginning of this pandemic. The issue of the Emergencies Act has come up a number of times, and I've continued to reassure them that I don't see it as being necessary right now. I know that all Canadians are united in wanting to fight this pandemic. I know that all premiers are thinking about the health of their citizens as well as they think about the health of their economy. And that's why I'm confident we're going to be able to continue to work together well and do the right things. Okay. On a depuis les débuts de cette pandémie
From the beginning of this
une
pandemic,
vingtaine de
we have
rencontres
had
des
some
premiers
20
ministres et
meetings
on a
with
toujours
first
très bien
ministers,
travaillé ensemble.
and we've always
Il y a eu
worked
des
very well
discussions
together.
sur
There have been
la loi
discussions
sur les mesures
on
d'urgence
the
au
Emergencies
printemps
Act
et je les ai
in the
assurés à ce
springtime, and I
moment-là,
assured
je
them
peux
at that point in
continuer
time,
de les assurer
and I can continue
on
to
pense pas
ensure
qu'on
them
a
now that I
besoin
don't think
d'utiliser des
we
mesures
need to
d'urgence. Je
use
pense
that
qu'on
at this
travaille
point
très
in
bien
time. I think we're
ensemble
working very well
et
together,
que nous allons continuer à
and
travailler très
that
bien
we will
ensemble
continue
pour
to do
protéger
so
les
to
Canadiens, ce
protect
que nous voulons tous.
Canadians, which is what we all want.
Morning, Mia Rabson from the Canadian Press. I'm just curious, in your conversation with President-elect Biden this week, did you discuss the ongoing confusion or uncertainty being placed on these election results happening in the United States? And also, if you have any unfinished business with the current president that you intend to tackle before he leaves office?
I had a very good conversation with President-elect Biden yesterday in which we addressed issues particularly around COVID-19, which is the great issue of our time, but a number of other issues as well. As I said from the beginning, it is not my role to be weighing in any fashion into American electoral processes. My job is to stay focused on Canadian interests and our interests around the world, and that's what I did.
Good morning, Prime Minister. Dominic Toronto Star. Could you address the vaccine distribution plan that you have and the logistical challenges that you've referenced? The U.S. has Operation Warp Speed. They've got the Army in charge. They've got a plan they're going to deliver from point A to point B. They've spent $12 billion on it already. We seem to be in contracting purgatory. We still haven't actually contracted anyone to do that. So can you speak to how you're going to do that? You want to roll out vaccines by January. How's that actually going to happen?
We've known from the very beginning that vaccines represent our best chance of getting through and beyond this COVID-19 pandemic. That's why from the summer, we've been working on signing contracts with potential vaccine creators around the world. Canada is one of the best positioned countries in terms of portfolio of vaccines. But it's not simply enough to have a vaccine discovered. It's not simply enough to have doses of those vaccines secured, and we have millions of doses of potential vaccines. We have to get them into people. We have to get them into people's arms. And if that's indeed the way that each vaccine gets delivered, there's a lot of variability. But in order to do that, we've been working since the summer on a comprehensive plan for distribution, recognizing that different vaccines will have different requirements. Some can be kept at room temperature, some need to be kept at -75, and there's a huge range of complexity around them. So the entire framework around distribution and delivery of those vaccines is very much being worked on. And I can turn to Minister Anand, and hopefully she will have a better sound connection than she had earlier to follow up on the plan for distributing these vaccines.
Yes, thank you, Prime Minister. Tonda, thanks for your question. In fact, we have been engaged in the planning for the administration and distribution of vaccines for many months, alongside of our vaccine procurements. And the way I think we should think about this is that, yes, it's a very complex process, but just as we did with our procurements of PPE, we will ensure that there is an effective and efficient vaccine distribution system in place. In particular, we need to think about 4 different stages of this vaccine distribution process. First of all, the regulatory process. Ensuring that vaccines are delivered to people is going to be contingent upon Health Canada approval. We already know that Health Canada has begun a rolling review of 3 candidates, Pfizer, Moderna, and AstraZeneca. We have also invested $173 million in Medicago's development in Canada to ensure that there is a made in Canada solution going forward as well. The next stage, biomanufacturing, is also important. We've invested in the NML's Royal Mount facility, as you know, to bolster domestic biomanufacturing capacity, to complete fill and finish, the final step in vaccine production, which may be required for some vaccines. Our investment is going to be very important. Alongside of that are contracts for 3 fill and finish machines procured from Burnaby's Van RX, and we're looking at additional domestic options to build fill and finish capacity. The third phase, distribution, we should note that the Public Health Agency of Canada, and I'm sure Dr. Tam will have items to add afterwards, PHAC is actively engaged in agile procurement for vaccine logistics. And in particular, my department of PSPC has issued an LOI and have heard from more than 70 companies already, ranging from cargo airlines and couriers to healthcare supply chain companies and cold chain experts. And we are working always with the provinces and the territories to ensure a seamless distribution system is established. And along that line, fourthly and finally, we have the administration of the vaccine itself. And again, contracts have been in place, Tonda, for some time. We've procured the supplies necessary for COVID-19 vaccines, including 90 million syringes and 100 million needles from Becton Dickinson, Sharps containers, 90 million alcohol swabs, 75 million bandages and gauze strips, and 90 million alcohol swabs from Cardinal Health. So by all means, our logistics operation is moving very well. We are going to establish in a very complex environment an efficient and effective distribution system for these vaccines once they are approved by Health Canada.
Kevin Gallagher, CTV. Prime Minister, Remembrance Day is tomorrow, but nearly 19,000 disabled veterans are currently sitting in a backlog, and they're upset, saying that if clearing this was a top priority for the government, it would have already been done. So what's taking so long? And Minister MacAulay, if you'd like to weigh in as well, feel free.
Since we took office over the past 5 years, we've invested more than $10 billion in new money in supporting veterans and their families. We know there's always more to do, but we have worked significantly to reduce veterans' backlogs, to reopen the 9 shuttered offices that were closed under the previous Conservative government, to be there for veterans in expanding services for their families, including mental health and PTSD investments. There is always more to do, but we will continue to stand by our veterans this week and all weeks as we recognize their service, their sacrifice, and that the country we now live in and cherish is due to so many of their efforts. Lawrence.
Thank you very much. And one of the facts that's important to note is, number one, the financial aspect. There was a lot of money put in, but there's also a 90% increase in first applications to Veterans Affairs. So, of course, that increases. It's very difficult to predict what takes place because we, at Veterans Affairs, we have no control on who will apply for a disability or whatever. But we have to make sure that we have the system in place. And without a question, we did that because with the $10 billion first initial investment, and then just previously $200 million, just under $200 million to address the backload alone is so vitally important. And with that, we're changing, like if you deal with an application, everybody that's dealing with that application is in one area. It doesn't have to be sent to one area or the other. We're digitizing the files to make sure that you push a button and find as quickly as possible. All this takes time. We hired 350 new employees. They're now being educated for this specific reason. So without any doubt, it's going to take some time, but we are certainly going to address the backlog. Thank you.
Hi, Prime Minister. Tom Perry with CBC. Your MP, Yasmin Ratansi, has left caucus. It came out that she hired her sister to work in her office. You had another MP, Marwan Tabara. He was forced out over criminal charges. So I'd like to get your response first in the case of Ms. Ratansi. When did you find out about it? What do you think should happen? But more broadly, do you think you've got a screening problem? Why do you have these MPs who, for one reason or another, have to leave caucus?
First of all, I am deeply disappointed by the news I learned yesterday from Ms. Ratansi and how she handled the office. It is unacceptable, and I expect there to be a thorough follow-up by the House administration on this. We have an extraordinary group of MPs in the House of Commons in all parties who have dedicated themselves to serving their communities and serving their country. And we need to know that there are strong rules in place to ensure that they behave properly, and we always expect the very best of all of them in our party and in all parties, and we will continue to hold that high standard. Okay.
Obviously, I was very disappointed to learn yesterday about what Ms. Ratansi had done over several years. I know that the House of Commons will do a follow-up on what she did and will take the necessary steps. But I want people to remember
tous les partis sont composés
that
de la Chambre des communes
all
est composée,
parties in the House of
de
Commons
députés qui se
are
dévouent
made up
à leur
of members who
communauté,
are
qui
devoted
se
to their
dévouent au
communities.
service de leur
They're
pays de
devoted
différents
to their
partis.
service
Il y a
to
des
the
règles à
country.
suivre
There are
et,
rules that have to be followed.
vaste majorité de
And
tous ces
the
députés
vast
suivent
majority
ces
of these
règles-là. Ils
MPs
sont des gens
follow the rules
extrêmement
and are
honorables qu'on,
honorable people.
se doit de reconnaître
And
pour
I
leur
think that
sacrifice et leur dévouement à
they
leur
deserve
communauté.
that we recognize their
Et c'est
service and
décevant
devotion to
quand
their
des événements comme
communities.
ça se
It's
produisent
disappointing
qui,
when we have these kinds of
ternissent la
events
réputation
that tarnish the
de 339
reputation of 338 MPs.
Monsieur Trudeau, Louis Blouin de Radio-Canada.
Mr.
C'est
Trudeau,
fort ce que
question.
vous avez dit tantôt.
What
Vous avez
did
dit aux
you
maires
said
et au
earlier
Premier ministre des
about
provinces, agissez pour
premiers
protéger la
and
santé
mayors
publique.
that they
Je
should
veux
act to
comprendre
protect
ce qui motive
the
cette
people of this
intervention-là de
country?
votre part
I'd like to
aujourd'hui,
know
de
what
sortir
motivates you
aussi
to
fort.
say something
Qu'est-ce que
so
vous
strongly
voyez
to
qui
them.
vous inquiète
What
tant?
do you
Est-ce
see
que c'est la
that is
réouverture des
so
bars en
worrisome
Ontario?
to you?
Est-ce que
Is
c'est
it
la
the reopening of
résistance en
bars in
Alberta
Ontario
et au
or
Manitoba
the resistance in Alberta and
peut-être
Manitoba
fermer certains
to
commerces?
perhaps
Pouvez-vous être
shut
spécifique,
down
s'il vous
certain
plaît?
kinds of
On est en
businesses?
train de
Could you
voir
specify, please?
une résurgence
Answer.
très
Well,
forte
we
de
are
la
seeing a very
COVID-19. On
strong
voit
resurgence
des
of
cas
COVID-19.
records
We're seeing
dans des
record numbers of
juridictions
cases in certain
qui
jurisdictions
pourraient en faire plus
who could be
pour
doing, where they
amener
could be
des
doing
règles et
more
limiter
to get people to
l'expansion,
follow the
l'éclosion
rules
de la
and
COVID-19.
limit
Le
these outbreaks of
gouvernement fédéral n'a
COVID-19.
pas
So
la
the federal government
responsabilité
doesn't have the
de
responsibility
dire
to
dans chaque
tell
région qu'est-ce
each
qu'ils devraient
region
faire, comment ils
what they
devraient
should do
gérer
and how
l'éclosion de la
they should
COVID-19.
manage
Mais on est là
COVID-19
pour
outbreaks.
dire,
But we
on
are
va
there
rendre la
to
tâche
say
plus
that
facile, on
we
va
are going
rendre
to
un
make
choix
this task
difficile,
easier.
moins
We're going to
difficile,
make
en disant
difficult
que
decisions
si vous avez
easier
besoin de fermer, si vous
by
prenez
saying
la
if
décision de
you
fermer
need to shut down,
rapidement
if you have
et de
to shut
limiter
down quickly,
certaines
to
institutions, certaines
limit
entreprises,
certain businesses or
certains
institutions
comportements,
or
on va être là
behaviors, we will be
pour
there
appuyer directement les
to
citoyens, pour
directly
appuyer
support
directement
citizens
les commerces,
and
les
to directly
entreprises qui
support
doivent
businesses
fermer ou limiter
that have
leurs
to
heures.
shut down or limit
On
their
va être là pour pouvoir
business
passer à
hours.
travers,
We
parce que la
will be there
meilleure
to
façon
help people get through this because
de
the best
protéger
way to
notre
protect
bien-être
our
économique pour les années à
economic
venir, c'est de
welfare for the
contrôler
future is to
maintenant
control
l'éclosion
the outbreak
de la
now
COVID.
of
On n'est pas en
COVID-19.
train de faire des faveurs aux
We aren't
entreprises en
doing
essayant
favors
de
to
garder
businesses
plus
by
ouvert
trying to keep
longtemps
them open longer
quand on voit les cas
when we
continuer à
know
augmenter.
that cases are continuing to spike.
C'est de pas bien servir
That
nos
is not
communautés, nos citoyens,
doing our
notre
communities
économie.
and citizens or an
C'est pour ça
economy a
qu'on est
favor.
là
And that is
pour
why
continuer
we are
d'être
there
là,
to
continuer d'appuyer
continue
directement
to directly support
les familles, les
families,
entreprises, comme on l'a fait
businesses,
depuis le début.
as we've done from the
Just get the
beginning.
English bit at the top part of that question. Lou was asking about Ontario, Alberta, just that top bit.
I think it's extremely important to recognize that we are in a resurgence of COVID-19. And there are things that different regions can do to do more to fight COVID-19. And our job as a federal government is to be there to make difficult decisions slightly less difficult, knowing that if there is a decision to shut down certain businesses or limit certain activities, we will be there as a federal government with direct supports for workers, for families, for businesses, for business owners, so we can get through this pandemic. The only way to ensure our economy will be strong next summer and the years after that is to hold on through this pandemic and make our top priority fighting COVID-19, doing what we need to do right now. The federal government doesn't decide who closes down where and how fast. But what we have done is made it easier for provinces to do the right thing, knowing that those direct federal supports for workers, for businesses, for families are going to continue to help us get through this as a family and as a country.
David Aiken, Global News. Just to switch topics, we've seen some new medical research now that suggests that those who have COVID, those who are diagnosed with COVID, much more likely to experience some mental health problems. So along those lines, knowing that sometimes it costs money to be able to get mental health treatment, we've got payments in place for caregivers, seniors, disabilities. What about a one-time benefit payment then for those who are required to take on some new mental health treatments? Is there a possibility you guys have some money for that?
From the very beginning of our first mandate, as a government, we recognize the need to invest in mental health services, and we invested $5 billion for the provinces to stand up and provide more mental health supports. Through this pandemic, we've invested in organizations like Kids Help Phone and United Way and various support organizations who are there to support Canadians struggling. And we're going to continue to work with provinces to ensure that they're able to deliver the kind of medical care right across the country to all Canadians that we need. Mental health challenges are certainly a really important part of what we're all dealing with right now. And the federal government will continue to be there to work with provinces on delivering the best mental health care possible.
Thank you. That concludes the questions for the Prime Minister. The doctors and the ministers will stick around for a little bit longer, but we'll go to the phone for questions first. So, operator, next question, please.
Thank you. Merci. Next question, Steve Shear, Reuters. Line open.
Hello. This is a question for Minister Anand. In the United States, the Department of Health and Human Services has said it expects to have enough doses of the coronavirus vaccine for all Americans by March or April. Yesterday, there was talk about, the Prime Minister talked about having enough doses perhaps of the Pfizer vaccine for high priority groups in Canada in the first quarter. But when do you expect all Canadians to have access to a vaccine?
Well, thank you for the question, and it does allow me to highlight the aggressive procurement stream that we have undertaken over the last number of months in the interests of the health and safety of Canadians. Through our procurements, we have ensured that we will allow Canadians access to a minimum of 194 million doses and a maximum thus far of 414 million doses if you include the options that we have negotiated. So these aggressive negotiations have indeed placed Canadians in very good stead as the vaccines reach their phase 3 clinical trials successfully and if they are indeed approved by Health Canada. We expect deliveries in the first part of 2021, and these delivery dates are in line with the European Union, Ireland, Japan, Australia, and New Zealand, and many other countries. So basically, this is the strategy of our vaccine procurements, and as I outlined in my response to Tonda, we are also having to put in place a very complex vaccine logistics and distribution program, which is well underway and very, very focused on the efficient and the secure distribution of vaccines for Canadians, because that is our priority. That is what we will continue to work on, and we will not rest until it is finished.
Follow-up, Steve?
You didn't really say whether you didn't predict any sort of date for next year. Can you be any more specific as to when 38 million Canadians will have access to a vaccine? Do you have any timeline on that?
So in order to provide you with the context here, we have 7 agreements in place. We have millions of doses being procured for Canadians. And with each of the suppliers, we are negotiating hard in terms of delivery dates. And so it is impossible for me to isolate one single date because of the magnitude of the number of doses under negotiation. But we are very well placed to have these vaccines into Canada, contingent on Health Canada approval, of course, in the first part of 2021.
Thank you. And next question, operator.
Thank you. Merci. Next question, Jolson Lynn, iPolitics, line open.
Hi, Ministers. Thanks so much for taking our questions. This one's for Minister MacAulay. Few veterans have applied for the disability benefit during the pandemic. Will funding from today's announcements be used to help more veterans access government support during this time? And generally, what's being done to make it easier for veterans to access benefits during this difficult time?
Thank you very much. And yes, in fact, it indirectly will, because the Legion, the NVets, the True Patriot Love, and Vets Canada, they all work hard with veterans organizations in order to, let's say, put together applications for disability benefits. All this kind of work is done through these organizations, and that's why it's so vitally important that the organizations have the funding. That's one part of what they do, but they do many other things too, dealing with homeless and emergency situations and a lot of other things. But yes, it will help.
Follow-up, Jolson?
Yes, and how soon, if there's a timeline available, can we expect the backlog to significantly shrink? And what do you say to veterans who are less disappointed by your government on this?
Well, yes, in fact, this process has started. The organization in the department is like groups dealing with applications. You don't have to send the application to one area to another. That has also helped, and there's been digitization. We're working on digitizing the files, and with that, in fact, it's come down slightly already, but we want to be careful. But we have 350, as I said, employees that have been hired that are trained to deal with these files. So putting all this together, we're very hopeful to have on 2022 to have. We don't expect we're going to totally eliminate the backlog, because there are cases that are difficult to deal with, and we have to make sure that the veteran receives the appropriate compensation for the injury they have. But in general, by 2022, we feel that these changes and the new employees will have a major effect on the backlog. Thank you.
CTV, Dr. Tam, back in August, Transport Minister Mark Garneau said that there's no evidence of novel coronavirus transmission on commercial airliners. What does the research tell us now about the risk for air passengers contracting COVID-19 on commercial flights?
Yeah, so there's been very few reports, extremely rare reports actually, of transmission aboard aircrafts. And I think we are learning more and more about some of the technologies, if you like, in terms of the ventilation and the way that aircraft ventilations work is actually, the modern aircraft is actually really good in terms of air exchanges and the way that the airflow occurs in the cabin. So there has been a few reports, but actually very, very little. I think we continue to ask provinces to report to us if you've seen reports to actual positive passengers, but have not demonstrated an actual transmission on board the aircraft itself. We have not received that kind of report. But the other thing is that in that setting, there are ways in which you could put in procedures like mask wearing. People are sitting facing the same direction with seat backs, in front of them. So there are a number of reasons, perhaps, as to why we are actually not seeing the actual conveyance itself as being a main area or setting of spread. Now, if you think of someone traveling from beginning to end, it may depend on where they come from, what they did before the flight, and what they are doing afterwards. That's really important for sure in terms of reduction of risk, and which is why we still have this quarantine period for people, for example, coming in from abroad.
And I just want to follow up on that with international flights. Since October 27th, 52 confirmed COVID cases have been traced back to international flights coming into Canada. So what's the resulting community spread from that, and why is it that travelers are not being mandated to quarantine at their port of entry, but rather their final destination?
Yes, so as just said, that the aircraft or the conveyance itself is probably not where the transmission is necessarily occurring. So getting people to observe public health measures and getting them to their place of quarantine is important. We ask everyone to have a quarantine plan, and that's being reviewed by the border service officers as someone comes in. There's a screening, obviously, for symptoms as people come in as well. So then it's just getting people to their place of quarantine if they have a plan in place. And so far, we have not, it may actually be quite a difficult thing to ascertain. We have heard reports of people inside that 14-day quarantine period being positive, but we have not heard of reports of transmission as a result of individuals. But for sure, there's, the risk of introduction is there, but we're not getting the reports about onward transmission as a result. So I think it's layers and layers of protection. Every layer gives you a different, an added layer of protection of all the airport measures, the screening when someone comes in, the fact that they're wearing a mask, they get to the destination with instructions not to, go shopping on the way there, get to the place of quarantine. They've already demonstrated a quarantine plan, and that's how, we are managing and with that 14-day quarantine period. As you know, we are examining pilots in terms of, for example, in Alberta, where they're testing someone as they enter, and then later on can help us look at what that quarantine period might look like going into the future.
Thank you. And Dr. Tam and Minister LeBlanc will now have to depart, but Dr. Njoo and the ministers will still be here as well. Okay, Dr. Tam will be here for a few more moments, though.
Hi, Minister Anand, it's Tonda again. Thanks for your earlier answer with all that detail. Can you speak to a couple of things I'm wondering about? Do you see a role, given that, you've got a bunch of companies that are, in theory, interested in contracting with you to do the delivery, but do you see a role for the Canadian Army in actually making sure that that happens? Maybe, if you don't have a good offer to those companies, maybe they won't be interested. So do you see a role for the Army? Why doesn't Canada have already a dedicated IT platform to do the tracking and tracing of all the data that's going to be needed to track the vaccines, each samples, make sure that things get followed up on, that the right conditions were respected? We don't have that yet. So could you address those 2 points? Minister MacAulay's waving at me. Sorry.
Actually, on that last part of your question, I will hand it over to Dr. Tam and Dr. Njoo after I speak to the first part of your question. I want to start by saying that the work on distribution of vaccines has been underway for months. We expect to have contracts in place for logistics service providers by the end of the month. It's an agile procurement system. We are conducting a competitive process while refining our requirements in consultation with industry experts, with public health expertise, and with provinces and territories. As we have done throughout the pandemic, we need to act together with the provinces and territories and across government to overcome the hurdles ahead of us. I will say that we are very well placed to have this complete system put in place prior to the approval of vaccines by Health Canada. It is this proactive approach which is going to stand us in good stead. I will also say, in reference to the armed forces, our government acted very quickly when the need was present earlier in the spring to send the armed forces, which we are so grateful that they did, into the long-term care homes in Ontario and Quebec. This was an incredible effort by the CAF, and our government and Canadians at large are extremely grateful for this effort, especially as we approach Remembrance Day tomorrow. In terms of the vaccine distribution piece, all options are indeed on the table. We are having a cross-government discussion about this, and in fact, just prior to this press conference, I was in the COVID Committee of Cabinet discussing many of these logistical issues that we are being asked about today. So we are working very hard on it. We are putting in place very, very strong systems, and we are working collaboratively with provinces and territories to do so because we recognize the importance for Canadians across the board in this regard.
So just So to add, there's an extremely meticulous process right now in working with the provinces and territories. As everyone understands, the provinces and territories are the primary responsible jurisdiction in terms of vaccine programs and vaccine delivery. So we are working with them, not just on the procurement side, the access side, the supplies, of course, coordinating all of that. So that a lot of work has been done to map out the existing logistical roadmap, if you like, and all the different capacity in the provinces and territories so that we can also identify gaps that need to be filled. So not only is there multilateral fora, we have the Vaccine Supply Working Group, the Canadian Immunization Committee, other federal, provincial, territorial bodies that normally come together when we look at our routine immunization programs, but that we have helped map out every step and the logistical requirements. Right now is an intensive sort of discussion, really has to be bilaterally with the different jurisdictions to work out the precision on the delivery, I think, that you're thinking about. Keeping in mind that some vaccines, and each one has different characteristics and different requirements. So that is how the discussions are going at the moment, from, you know, the minus 70 plus sort of supply chain versus others, which are much more traditional and people are much more used to. So I think the federal government is there to help with particularly with the more unusual supply and requirements, but has to be worked out with the manufacturer, of course. So there's these different components are coming together to make a decision on, you know, the precision on that supply state. So it is a very complex process that has undergone extensive mapping, and then now it's just addressing what those needs are. And it will not be, you know, one size fits all. The existing distribution patterns in each of the jurisdictions are already a bit different. And so we actually have to work with those. But the full extent of the rollout approach includes not just logistics, of course, but as you say, the monitoring, not just distribution, but the coverage, who got what. You need to have 2 doses. That has to be logged so that someone gets the second dose on the right time. So these are some of the details. But also, while you know, Health Canada and the process for safety and effectiveness phase 3 trial and the results will be reviewed in a rigorous manner, we still have to monitor vaccine safety and effectiveness as things are rolling out. So all of those pieces come together as part of some of the key implementation considerations.
So my follow-up, I asked about whether there was an IT platform. Why don't we have an IT platform that can do all that right now? They've built a purpose-built one in the US. We don't seem to have that, if I'm correct. And Minister Anand, I just want to also ask, you were asked earlier by somebody about the timeline, and in your procurement documents, they reference Q2 2022 for the length of time these logistical distribution contracts would be, I guess, executed. Is that not the timeline then you're thinking for all Canadians to be vaccinated? So my 2 questions again were IT and the timeline.
Well, I will speak to the timeline, and I will allow and ask the doctors to speak to the IT piece. On the timeline, Tonda, there is the requirement for Health Canada approval. And so our contracts and our distribution mechanisms are contingent on that, as we've said repeatedly. And so the timeline really revolves around that approval process. Regardless of what is in our contracts, no vaccine will be distributed until those approvals are granted by Health Canada in the interest of health and safety. And as I said, we are a government that follows the science, and that's exactly what we will do. In terms of what our procurement documents say, I'm actually very interested in your characterization because they're not uniform in terms of what is said regarding delivery timelines. And to some degree, those delivery dates are being continually negotiated as we see these companies come through phase 3 clinical trials and as the rolling review process takes place in Health Canada. So as I said, our delivery timelines are consistent with many other jurisdictions, including the European Union, Japan and New Zealand, and Australia. And we are expecting, if all goes well with Health Canada approvals, to be able to distribute vaccines in the first part of 2021. And we will continue to put in place the complex logistics system in order to make sure that those deliveries to the provinces and territories occur efficiently and effectively.
Just to add that the transfer of information is part of that rollout plan that has to be discussed with provinces and territories, and is part of the intense implementation planning that is being done. But, you know, obviously there has to be a balance, because you can't sort of putting up entirely new IT platforms in the middle of an emergency has pros and cons. So we really do need to understand the extent to which that those requirements are. And so those types of requirements are being mapped out as well, including the IT requirements. As Minister Anand has said, you know, I think from a public health perspective, we have to plan with certain scenario as though we're going to get vaccine from a certain point in time so that you can be ready. It is possible those timelines will move, for sure, depending on clinical trial results and many other factors along the way in between the clinical trial itself and getting the vaccine actually on the ground. Lots of things can shift, and we have to be able to flexibly shift with that. But I think from a planning perspective, we are, you know, setting ourselves up so that public health authorities will be able to, in sort of optimistic timelines, look at some of the deliveries being done in the beginning, sort of quarter one of 2021. As to how all the other vaccines or the other vaccines that being where there's agreement will roll out, some of them we haven't seen a single result from the phase 3 yet. So those timelines will necessarily move and be flexible, but then we need to be ready. So which is why mapping out, you know, the logistics right now in detail is really very, very important.
Thank you. That concludes today's press conference.
Thank you. The conference has now ended. Please disconnect.